Hi, Doctor Arvind Poswal, Dr. A's Clinic, Delhi, India. Today we will be talking about a young Caucasian white male who wanted a absolutely non-balding hairline. What I say, a hairline to fall in love with. Now, everyone who loses hair when he wants a transplant, he does not want only few hair. What they want is all purpose dense hair with a very wonderful young hairline. If you see this patient, his before pictures show that he has lost a lot of hair in his entire hairline frontal area going back to the start of the vertex area. Now, one option by traditional ways would have been to give him a very high hairline using only 2500 to 3000 grafts. A lot of time patients go to doctors and the doctors straight away tell them that this is the only thing possible for you. Let me say, now science has evolved. We have invented body hair to scalp transplant, and I'm very happy, of course, to say that we have invented beard hair to scalp transplant also. So, by the FUE technique, we can take lots and lots of graft to create young hairline for patients, something which was not possible earlier. So in this case, we created a Norwood Zero or a absolutely young hairline. The hairline that when one looks at him, the reaction would be that yes, he has lost no hair, and his condition was that he should be able to even gel or comb the hair the way he wants to. So we transplanted 4,200 grafts in this case, and they were taken all from the scalp donor area only. Now there is a difference. Remember, sometimes people feel that everyone should be able to get that many grafts from the head in a single session, but there is a lot of difference according to the racial background of the patient. A Caucasian patient has thin hair. Caucasian meaning a white European or North American person. So they have, each individual hair is very thin. So the number of grafts per square centimeter has to be high, as we did in this case. A similar thing for another patient who may be a black American or from Africa or from South India or from the Orient. There is Korea, China. There the hair are very thick, whereas the number of grafts per hair is less. So nature has done this sort of a compensation, and a good hair transplant doctor has to make adequate compensations according to the racial background of the patient also. That is why I am not very fond of some standard charts categorizing people into Norwood 5, Norwood 4, Norwood 6 stage with a fixed number of grafts. It is always going to be a customized graft estimate for you or based on mathematics, the area involved and the amount of donor that we have. Now coming back to this patient. Now he was very pleased, and also he did one more thing. He shared pictures of his scalp after every 1 month. I think that is something that many patients want to see. So after his hairline was done, as we can see, we have created a absolutely young hairline. So once the hairline is done, then we have pictures of 1 month after the transplant. Now if you see this patient, he is a very fair patient. So the fairer the skin, the more you will see a light pinkish hue on the scalp. Don't worry when you see that. Dark skinned people often do not see it. But that doesn't mean that the blood supply does not increase in the transplanted area. Even in these 2-month-old pictures, you can again see that. So this is the process of skin regeneration. We have made the cuts, we have put new hair roots there. When the hair were lost, this thin skin had thinned out because the capillaries were not required to push that much blood. There was no need of that much nutrition. There were no fast growing hair in that area. Now when we have put the hair roots, apart from the fact that we have made those many slits, then the body realizes that it has to push a lot more blood because a lot more nutrition, oxygen, everything is required. So this pinkish hue, one doesn't need to worry about this. Now we see gradually after 3 months how he looks. The hair will grow in a random manner. Don't worry about your hair growth at month 4. See there, not always hair are growing. It takes time. Now when we go to month 6, accordingly we see the redness is much less. Another good thing about this patient was that he did not give pictures in with dry hair. He used to take pictures after bathing. So what happens in that case? After taking bath, the baldness is accentuated. The visible baldness is accentuated. So if some of you, sometimes patients say that in his 6-month picture I can still see some of his scalp, of course you will see. If a man has a full head of hair, he will see that even in that case. So don't worry about that. Understand when you are seeing this. This is one of the world's my best result in terms of what the patient wanted. Of course, in terms of naturalness, I do it for every patient that it should look natural. So finally, this patient, he was very happy with the result. He posted his 8-month pictures with the hair gelled. So this is what I often tell patients, that I can keep on putting more hair, as much hair as they want. There is no upper limit to that, as long as you have that many donor hair. Unfortunately, there are some doctors or some consultants who do try to cheat patients. And the patient should be aware of that. I cannot blame only the consultants. They, after all, have marketing backgrounds. That's what they are taught. But then they will try to say that yes, even if a person is totally bald, a Norwood 5 or a Norwood 6, they'll try to say that yes, we'll cover your entire head with 4,000 grafts. Here you see we have created a very young, dense hairline, full frontal coverage. The patient can wash his hair and still look natural and dense. It's not just combing the hair in a particular way or putting some hair powder, etc. This is totally natural, dense, young hairline. As I say, a hairline to die for, or a hairline to fall in love with. So, as I was saying, never let anyone fool you by saying that they will be able to cover your entire head in 4,000 or even 5,000 grafts. What they are basically saying is that they can take out only these many grafts, no matter how bald you are. So, whenever you go to a doctor or a consultant or a clinic, first question you should ask is, how much hair have I lost? We go back again to the before picture of this patient. Now when we say his before picture, the entire head contains 40,000 grafts before hair loss starts. Now in this case, if you see, you can easily make out that he has lost around 20% to 25% of his hair. So that is how one understands the graft estimates also. So see the result. I hope you send me feedback and comments also. Do remember to share this and to subscribe and to like us. That really helps. And do share it with all the young people or all the people you think who need a hair transplant and are looking around for this. We offer online hair transplant consultation facilities. Anytime you want, send us pictures on the WhatsApp and by email. Thank you.